I'm Ruth Eglash, a Jerusalem-based correspondent for The Post, and I'm about to receive a coronavirus test at a newly built roadside testing booth. Created by Maccabi, one of Israel's public health maintenance organizations, these testing booths could soon be everywhere, with the aim of increasing the number of tests for COVID-19 and streamlining the process of tracking the virus.
Very handy. There is a garbage here are the tubes, and this where he puts all the tubes that needs to go to the lab.
Israel seems to have kept its number of COVID-19 cases and related deaths relatively low. As of April the 21st, there have been fewer than 200 deaths. But in recent days, as the government eases a month-long public lockdown, there is fears of a wider outbreak. I know this is a practice test, just to see how these roadside testing booths work. But for some reason, I still feel nervous about being prodded and poked by someone using big ungainly rubber gloves and staring at me through a glass screen. He asked me to swipe my health insurance card to register my information in the system and then asked to see my ID. Then I wait for him to get the testing kit ready. The test makes me wonder if this is how it's going to be for all of us in the future. Will we need to stand here in front of a booth like this every time we get a sore throat or have been near someone who has COVID-19 or any time we want to travel? It seems likely now, or at least until a cure or vaccine is discovered.
Now it's going to be low. It's not very
The test is over quickly, and it didn't hurt that much. But I won't get any results, because according to Israeli Health Ministry criteria, I'm not eligible for a test. Luckily, I do not have any of the symptoms of the virus. Israel is currently conducting more than 10,000 tests daily. Receiving the results, however, can still take a few days, though there are efforts to reduce the waiting time to under 48 hours.